Hello again, everyone. My name is Marty Guthmiller, and I'm CEO at Orange City Area Health System, bringing you today on July 6th, the 35th edition of our COVID-19 community briefing. I'm going to go through the statistics like I normally do. I want to start out today, though, by emphasizing that our IgG testing begins today at our walk-in clinic at noon. Our hours are noon to 4, Monday through Friday, and that begins today. And the IgG testing is the antibody, it's a blood test for the antibodies to the coronavirus. So that begins again today at noon. Just FYI, statewide, the number of positives in the IgG test are 7%. So that number is climbing a little bit. So there are more antibodies present, but if you'd want that test, begins today, and this is a cash kind of situation. So the charge is $60 for the IgG test, and if you believe that you have symptoms meriting an IgG or circumstances, and your insurance might cover it, that would require a clinic visit to be attached to that with a diagnosis. So you would need to schedule a clinic visit if that situation exists for you. So we're going to jump right into the statistics today. It's been about 7 days. I think the last time that I've given the local update with the scoreboard was June 29. And so we have a number of updates here. 46 positives. That number is up 3 since June 29. The 46 positives are of 717 tested, and that is a positive rate of 6.4%. That is down from 6.9%. So pretty good number for us here locally. We do have 5 tests pending, which we always do. Again, typically those are for our pre-surgical patients. At the Sioux County level, we have talked about these numbers a little more recently. July 1st was the last time I gave an update on the county-wide numbers. We've had 18 more positives in Sioux County since July 1st. However, we've had a lot more tests done in Sioux County as well. So we have 473 positives of 3,008 tested. That's 1 out of 12 of all the residents in Sioux County, and that is a 15.7% positive increase, our positive test rate, and that is down from 15.9. So a little over double what our rate locally is, but as a county, we are coming down as well, and that's a good number at 15.7. Region 3, the 20 counties in Northwest Iowa, currently has 30 patients hospitalized. That number is down from July 1st at 33, so down slightly. We have 8 patients in the ICU in Region 3, down from 12. And there have been 3 admits in the 20 county area in the last 24 hours. In the state of Iowa, we've had over 2,300 positives, more positives since we've last talked. But again, the number of tests has increased as well. I'll share those numbers with you. We've had 31,656 positives in the state of Iowa of 335,716 tested. That is a 9.4% positive rate. That is down from 9.5. So while I said the number of positives were up 2,300, the number of tests is up over 27,000. So we've done a lot more testing. And so when you do a lot more testing, you're going to expect more positives as well. But again, as a percentage, the number is going down. 1 of every 9 Iowans has now been tested. The next thing that I look at in addition to the positive rate is the hospitalization rate as some measure to me of the acuity level of patient. How sick are patients getting from these 31,000 exposures that we've had? Not exposures, but positives. Currently, we have 129 COVID-19 inpatient hospitalizations in the state of Iowa, 129. One of those is in Sioux County. Zero of those, zero still is true for O'Brien and Lyon County. Plymouth County has 3. Clay and Dickinson County, 0. BV County, 4. And as you know, BV's been a little bit of a hot spot, but they were down to 3 the last time we talked. So they went up from 3 to 4, not a huge jump. Sioux City continues to decline in terms of the number of admits, currently at 14. Last time we visited, they were at 16. Polk County has stayed exactly the same as July 1 at 31 patients. Polk and Woodbury County are still 1 and 2 respectively in the state of Iowa. Number 3, and there are several number 3s, are 5. So there's quite a bit of drop off from number 1, Polk County at 31, number 2, Woodbury County at 14, and then several others at 5 hospitalizations across the state in the county. The number of deaths in Iowa has grown again since the last time we talked by 4, currently trending down dramatically. It's really falling off, but it's still 4 more deaths. It's still a serious matter. This marathon that we're in is not over. We're still in the race, and we still need to keep that in mind. It is still very much an elderly concern more than a youth concern relative to the acuity level of this virus. It's very much the same. I don't want to downplay the deaths at all, but you do have to keep in mind, relatively speaking, where we're at in that curve, and it is significantly down, and it is starting to level off in a very good way, even though every death is still a very serious matter. So as we wrap up today's session, generally things are on a good path. They're on a good track at this point. Let's keep in mind the number of tests are increasing across the state, becoming more available. So we are going to see more positives. So, but let's keep track of that positive rate. Let's keep track of the hospitalizations. Let's keep track of how sick people actually are getting from this. And fortunately, over the last little while, that's been a very positive thing. We're seeing patients, but we're not needing to hospitalize them, and they're able to get through this. Keep masking when you're not able to maintain the 6 feet or 15-minute rule. Keep trying to do that. Be outside as much as you possibly can. Use common sense. Remember to control what you can control. Live your life. Be grace-filled. Stay vigilant. Stay strong. And again, above all, stay healthy. Thank you for joining us, and we'll see you later this week.